The proportion of the population in the EU member states aged 55 years and over is about to increase by 50% in mere 40 years between 1990 and 2030 to 37% of the whole population. Social and health services in all EU member states face enormous challenges in the near future in adjusting to these developments, since it is associated with altering of employment and family patterns and funding issues. Moreover, the senior population is a moving target, and it means the senior care services and the established ways in which these services are provided today will not work in the future. There are several key factors influencing the future contents of senior care services, consequently changing the content of job profiles and job competencies of care workers. A common profile of a current user of senior services has been undergoing significant long-term changes. Namely, expectations of future users of social services will not be focused only on avoiding sickness, but also on maintaining independency in their choices and maintaining an active form of life. There will be a wider gap in the financial status of senior citizens, meaning there will be a need for better quality and greater variation of the content of services. Boundaries of the current elderly care services are changing, and new service areas are emerging which will have to meet the needs of new senior users. Since in the future older people may wish to maintain their selected form of living to the end of their life, there will be a need for 24-hour, 7 days a week services. Moreover, specialized services in wellness, tourism, household automation, and many other areas are ever more common. Everyday introduction of technological solutions and new software applications have been influencing significantly work organization and competence profiles of care personnel. Technologic solutions in the areas of administration, self-diagnostics, and health monitoring systems, robotics and assistive tools, supervision, communication and social relations, intelligent homes and smart housing become persuasive while getting increasingly flexible and interactive. It is a major challenge for the senior service staff to increase their competences in order to make the best use of the technology. Obviously, there is a need to give lifelong learning opportunities a higher priority. These developments attest to the need to review the existing vocational systems in the senior service care sector with a view to develop revised job competences of staff and to raise the standards of quality and professionalism. A fundamental role in this respect is assigned to the CVET system in development of training content with innovative features in order to allow carriers to acquire new competences and skills which will meet better present and future demands of their jobs. Research has shown that ongoing trends are clearly reflected in a growing need for broadening of the required portfolio of skills in the senior service sector at all occupational levels. Non-routine problem-solving and analytical skills or transferable key competencies such as digital and communication skills, self-management ability, and capacity to engage in continued professional training are in much higher demand than ever before. Throughout EU, there are numerous job profiles developed in the fields of social caring and nursing professions. In some countries, the range of alternatives is extremely broad. Consequently, it is in general quite difficult to achieve recognition or validation of skills acquired in these fields across national borders. In spite of this fact, mainstream job profiles are similar and the job skills and competences they involve are almost identical.
Here we are in Provincia di Livorno Sviluppo, our premises, and our company is settled in Livorno, and so we have a consolidated experience in European projects. We see our colleagues working at their desks now, and we have experience on lifelong learning program, Erasmus+, Italy-France Maritime, Horizon, Twinning, etc. And we have a broad network of partners, institutions, public authorities, and private bodies from all over Europe. And we are a training agency, a body for research and development to promote local economy, employment strategies, social inclusion, gender equality. Here we see a meeting to prepare a course. Now on the first floor, we meet the other colleagues. Provincia di Livorno Sviluppo is involved in many areas of interest as tourism, environment, logistics, maritime and port sector. Hi Silvia, nice to see you here finally to log in into our course. Did you see already our website, the Moodle of our online course?
Yes, I was having a look at module 4 on base senior workers techniques. In the future, I'll be able to suggest some devices and know if there can be of use for the person I am looking after, because of course there are some technologies that I didn't know existed. So
And now, Silvia, may I ask you to reveal a real good surprise you have for us? Because I know that you received what?
yes.
After
A
the
job
course, yeah.
yes, I just received a job offer in a healthcare house in England. So.
In 2014, Erasmus Plus Strategic Partnership ASE was launched to address one of the aspects of coping with the issue of Europe's aging by development of the new CVET training system for workers in the senior service sector. Our partnership has identified and grouped together into training modules the competences that are common across the partnership borders, which in the aggregate encompass the complete skill set of social worker caring for the elderly in home and community-based settings.
Elisabeth, it sounds like it's much work that you are doing there.
It has been, really.
Yeah, what is the benefit for our department?
There are several benefits, I think. First, especially the online parts of the new training are very helpful for us. We already tested these parts within a further training for case and care management, and the feedback of our participant has been really encouraging. They really liked to do the online parts, for they could decide when to learn. They had been more okay. Also, they appreciated the information about community-based work. We plan to make this as a regular part of our officially recognized management trainings for nurses. This is one part, and the other part, we are in the quarter of Bremen, where the IBS is situated, Himmelingen. We are a part of a network called Alte Vielfalt, or Old Variety, I think, maybe the translation. The members of this network are all engaged in health and social care for the elderly. They are backing our project, and they are very interested in the basic module. They want to use basic qualification for their unskilled workers. So it can be seen there is a great interest in the modules on very different levels. For us, the participation of the project turns out to be a success. Moreover, it has been a good experience to have an exchange with other countries. I really learned a lot. And on a personal level, it is not so, in the not so far or distant future, we will grow old and may need to rely on aforementioned services. So it will be in our own best interest that there exists good, friendly and understanding service and nurses which we can rely on and which we like to work with.
Learning outcome units became the cornerstone of our training system. We built the training program around the work competences included in the units. We started with drawing the basic framework by defining the key parameters of the system. 200 hours of classroom instruction in 5 compulsory training modules, complemented by 230 hours of fieldwork and 170 hours of alternative online study. 80 hours of classroom instruction in 2 optional training modules, complemented by 80 hours of fieldwork and 80 hours of alternative online study. Introductory 60-hour classroom course with 40 hours of fieldwork for entry-level senior service workers. The work of our partnership reacts to ongoing developments in the senior service sector and brings a number of new elements into continuing vocational training of professionals working in this field, aimed at meeting the current and the future needs in this rapidly evolving sector.
Hello, I'm Laurent Cheter. I'm a physiotherapist and conductor teacher in our institute, MEREC. We are a state-run nationwide institution. Our clients come from all over the country. So this means that we have also residential places for them. We provide complex rehabilitation for our clients.
The principal innovations are unified training content across our partnership boundaries. Over 95% of the learning content is identical regardless of the country where trainees take their classes. The training system is integrated with job competence assessment, validation and recognition tools which enable job transparency and workforce mobility across the partnership borders in the senior care service sector. Modular design of the training modules. Training units are concise and short. This feature offers a suitable flexibility in scheduling classes for trainees with different vocational education backgrounds and work experience. It also helps in better targeting specific competence elements. Modular design will also permit future extensions of the instruction contents when a need for training of new competencies arises. The system is enabled for online-based training. Combining classroom instruction and online learning offers even more flexibility in selecting suitable learning paths for the trainees. It allows differentiated learning in a classroom and employing tools for validation and recognition of competences acquired earlier in informal or non-formal ways. The analysis pointed out that the key to meeting better the new and future demands on carriers in the senior service sector is inclusion of development of key competences, often also called soft skills or transversal skills, into the new training curricula. Acquisition of the core work competences is therefore combined with training of key competences, much needed by senior care personnel, such as communication skills, digital competence, social and civic competences, and ability to learn throughout the professional career. The training system is integrated with the ECVET system for assessment, validation, and recognition of previously acquired knowledge, skills, and competences involved in the senior service profession. The complete set of work competences identified in the initial phase of our work has been broken down into a set of individual learning outcome units. A trainee who completes successfully an assessment procedure of any given learning outcome unit is certified to possess the matching set of work competences. This is equivalent to completing the corresponding learning unit of our training course, which builds the very same competences. Thus, the ECVET system is an effective tool in supporting flexible learning pathways of trainees on their ways to earn professional qualifications in the social service sector. Employment of the ECVET system will have a positive impact on job transparency and workforce mobility in the senior care services sector across national borders within the European Union. On the regional and local level, utilization of the ECVET system may have a positive impact on standardization of skills and competences of the senior service sector. Our training courses for senior social care workers are freely available in 6 European languages, including English. Therefore, we hope the initial impact on improvement of care workers' qualifications in the partnership member countries on the regional or national level will be followed by a gradual adoption in other European countries. In the long term, we hope to see a snowballing effect as more CVET organizations across Europe will be providing higher quality training which matches better the senior citizen needs with a skill set and competences of social care staff. Employment of the ECVET system for assessment and validation of knowledge, skills, and professional competencies of care workers jointly with the training system will have a positive impact in much improved care staff mobility and transferability of competences initially within the boundaries of our partnership and later on among other EU member states. Notable improvement should be especially seen through better engagement of transferable key competencies. As a partnership, we wish to set off a wider adoption of our methodology for development of innovative, unified training programs spanning by its impact multiple EU member countries. The process utilized for development of our training modules for senior service workers may be adopted in different sectors and different contexts for preparation of another CVET programs that will improve job transparency and mobility across the European Union. And yes, after almost 3 years of work, we can spread the news out to the community of stakeholders, interest groups, and anybody else who cares about the issues of aging in our neighborhoods. You can take part in the new training course too.